All these things nurses are really good at, right? I mean, so recognizing that there might be some limitations associated with aging. So whether those are physical limitations, whether those are difficulty hearing, difficulty seeing, maybe some slight cognitive impairment, that older adults just might need a little bit more time, a little bit more caring in negotiating everything, whether that's coming in actually into a medical exam room or whether that's talking about the illness and talking about the types of treatment. So first, I think, is just understanding and acknowledging that they're older. Acknowledging this concept of ageism. So oftentimes when older adults interact with the medical system, they confront ageism. They confront people who just basically, to some extent, either ignore them or, if the older adult comes with a family member, the physician or the nurse will talk directly to the family member and just kind of not even look at the older adult. And so kind of understanding the concepts of ageism are really, especially in the United States, are alive and present. And so once those are kind of the initial things, then after that, in terms of nurses, just kind of understanding conceptual nature of what it means to grow older. So these concepts of significant losses, loneliness is a component of generally growing older. These things such as, kind of this idea of a life review. And they might be looking back at their life with some things, again, that they're proud of and some things that they might regret. This concept that older adults actually, part of the developmental trajectory is actually kind of passing on their wisdom to the younger generations. So might be really interested in talking with the nurses about kind of what they've done or where they've been and connecting in that way.